Hi, my name's Evan Meadows, and I'm a third-year PharmD student graduating in 2022. Since I came into pharmacy school, I knew I wanted to do something involving research. I had a little bit of experience with research in undergrad, but that was mostly bench research, working directly with samples, pipetting things. And I really had to be honest with him when I was going into this because I knew nothing about this type of research. And they were amazing at helping me learn the basic skills and working with me to, go through the basic levels of the project all the way up to the more advanced stages. The main goal was that we wanted to look at patients with chronic kidney disease at the VCU CKD clinic. And we were specifically looking at these patients with the idea of, are these patients getting appropriate cholesterol control through a class of medications called statins? There are guidelines out there, and these guidelines provide us references, just making sure which patients with chronic kidney disease should be on statin therapy. And this is really important because patients with chronic kidney disease, their number one cause of death is actually cardiovascular events, so things like heart attacks, MIs, and strokes. So that's really what we were looking for, and then we go to our data set from our clinic to see which of these patients were actually on the appropriate therapy. This is something that I found has really become important to me, and I'm excited to hopefully be able to present this later this year. If we don't actually look at things on a specific patient level in areas like clinics, especially clinics where people may be underserved, underinsured, we really don't know how these patients are being cared for. So one of the big questions that we're all asking ourselves is, why are we doing this? How is this going to make a difference in our patients' lives? How is this going to help them and help us provide them better care? And at the time, I didn't really recognize how important it was to follow up after these guidelines have been published. If these guidelines aren't being followed and these patients aren't getting adequate care, then something needs to change. Something on our end needs to change as healthcare providers and pharmacists to actually make sure these patients are being taken care of. And we really need this data to go back and say, well, or can we do something differently? So I can honestly say that this research project has totally changed the way I view research and even how I view my experience in pharmacy school. Going into this, I have had basic classes on research, reading, journal articles, various things like that. But I really did not understand how little I knew until I actually had firsthand experience doing it. And I'm honestly so grateful to Dr. Salgado and Dr. Fleury. This is an experience I don't think I could have had anywhere else with any other professors in any other situation. So I am so incredibly happy that I got the opportunity to do this and thankful. So I would just say if anyone feels interested in this field at all, just get out there and put yourself out there and try to get involved.